How to use your turbuhaler. Start with sitting or standing up straight. Then hold the turbuhaler upright with one hand holding the base. With the other hand, twist the cap counterclockwise to remove the cap. Now turn the base fully in one direction and fully in the other direction. You will hear one click. It doesn't matter if you hear the click on the first turn or on the way back. The click is the dose indicator wheel decreasing down by one dose. Next, turn your head sideways away from your turbuhaler and slowly breathe out. Holding your turbuhaler horizontally, place your teeth over the mouthpiece and your lips tightly around it, being careful there are no gaps, and also check not to cover the holes on the side of the turbuhaler. With your head tilted back slightly, inhale through your mouth quickly and forcefully, breathing deep into your lungs until they are completely full. Hold your breath for 10 seconds, or if unable, as long as you possibly can. Remove the turbuhaler from your mouth and slowly exhale away from your medicine. If you need a second dose of medication, repeat the steps again. Twist the cap back on your medicine to keep it clean. When you first start seeing red in the window of the dose indicator on the side of your turbuhaler, you have the last 20 doses of your medicine left.